How serious is scoliosis in children? Unfortunately, scoliosis can affect all ages, but it's most commonly diagnosed in children. We normally categorize the diagnosis of scoliosis in children by age group. And the first age group we want to talk about is something called infantile scoliosis. And infantile scoliosis is typically diagnosed between birth and roughly 2 to 3 years of age. And again, infantile scoliosis, the most common type, is something that we will call congenital scoliosis. And this is when they're born with scoliosis because some kind of abnormal shaped vertebra that occurs in utero. The second group of patients that we look at is something called juvenile scoliosis. And juvenile scoliosis affect patients that are roughly 2 to 3 years of age to roughly about 10 years of age. And in this group, they're diagnosed with something called juvenile scoliosis. Now, adolescent scoliosis is diagnosed when patients hit 10 years of age and anywhere between when they're fully grown or fully through to skeletal maturity. Most people will say anywhere between 10 and 18 years of age. Now, the most common type of adolescent that's diagnosed with scoliosis, it's typically called idiopathic scoliosis. Idiopathic scoliosis means that we don't know what's causing the scoliosis to actually occur. Now, there's one last type of scoliosis that's not congenital and not idiopathic, and that's called neuromuscular scoliosis. And neuromuscular scoliosis is a type of scoliosis that occurs that happens as a result of a neuromuscular condition. And again, can happen in any age group. Now, adolescent idiopathic scoliosis is definitely the most prevalent. And that's because at this age is when patients go through this phase of rapid progression. And this phase of rapid progression is associated with puberty or with growth spurts or rapid growth spurts. And in this phase, curves can change very quickly. I've seen curves change 20 to 30 degrees in 6 to 8 weeks, where a patient can have a very mild curve and a very serious curve. 8 weeks later, the fastest progression I've seen curves progress 60 degrees in 6 months with a patient that chose not to do any type of treatment. 6 months later, a 60-degree change in their scoliosis. So we know that scoliosis is a progressive condition. We don't know what causes scoliosis. We know growth and progression are corrected, so therefore every child that has continued growth, scoliosis should be taken seriously. And the sooner that scoliosis is diagnosed, meaning pre-puberty, before their growth spurt, the more likely the curve will continue to progress into a severe number. So therefore, adolescents that are going through their rapid phase of growth are most susceptible to this progression because, again, like I mentioned, that's when puberty happens. That's when the most accelerated growth tends to occur. But any child, even juvenile or infantile, they're still growing. They're still having growth spurts before that adolescent stage. So they're all at risk during growth. And what's scary about scoliosis is a lot of times if there's very slow growth, you may see no changes with the curve. And you kind of take it and you start letting your guard down, not taking it very seriously. But then you see this rapid growth and the curve can change very quickly. So things can change to the negatively relatively fast. So therefore, we always say take the scoliosis seriously in any patient that's still growing and developing. The physical effects of scoliosis on children normally doesn't cause pain. The child can't tell you my curve is worsening. They can't say, hey, mom, dad, my curve is getting bigger because I hurt more. They don't feel it. It's only what you see physically in their posture or on an x-ray. So it's the most common symptom in a child with scoliosis, even if it's worsening, it's just going to be postural changes. And these postural changes can include many things like uneven shoulders, uneven hips, some of the earliest signs. And it can be very slight initially and become very severe as the curve gets bigger. It can be changes to gait, balance, and coordination also is very common. Another thing could be asymmetrical rib cage, asymmetrical arms hanging at different levels. And normally, again, it's not painful. It's normally just what you see. But once this scoliosis becomes visible and you can see it in posture, it often now becomes an emotional problem for children because not only is there the physical effects that you can see physically in the person's body, but when you start changing the way a person appears, oftentimes the emotional effect of scoliosis can be not really addressed. And for many patients, it can be very different because some patients are more affected by what they see in their own body versus others. And it's hard to determine how the emotional impact on a child growing with scoliosis. But we know this age group, kids, adolescents, growing and developing their self-image, they're already at risk of developing a negative self-image because of body issues, because of hormone, developmental, pubescent changes. So therefore, any physical changes to appearance for an adolescent going through growth that's just trying to fit in and trying to look like everybody else and walk like everybody else can be very stressful. It can have lots of emotional impacts and how they don't really want to fit in with their peers. So therefore, this is something that we also want to take seriously, because as their curve becomes bigger, they become feeling more different. And we also know sometimes scoliosis, because of the size of curve, can create an activity restriction. And this can affect people that are heavily into sports or may have to give up or modify some activity because therefore they can't do it as a result of the scoliosis. As a progressive condition, we know scoliosis has no cure, right? And we know this can be very difficult for a young person to say, hey, I have a problem that I can never heal from or never fully cure, right? And the way you manage this diagnosis will really shape the rest of their future, because you can't cure scoliosis. We're just trying to manage the expression of the curvature by keeping it as minimal as possible. And as this progressive condition starts to affect the posture, starts to affect the way the body's moving and reacting, and especially if it's left untreated, how it can progress in the adult stage, leading to pain and discomfort, the importance of how we react to this right now can really set a lifetime in terms of health or well-being, or really a reaction to scoliosis and how it's affecting them. Now, there's never guarantees when it comes to a treatment to scoliosis, because it's an idiopathic condition, meaning we don't know what's causing it. But we do know if you treat it early when it's first detected and treat it when it's smaller, there's much fewer limits that can be achieved with non-surgical intervention. And this is important because when it comes to improving the changes that occur in somebody's body, the more natural we can keep this person, meaning without rods and screws or titanium rods or invasive surgeries, the more likely they're going to be not to have any future problems. So therefore, avoiding these changes with conservative treatment doesn't address the spine, meaning by making the spine as straight as possible at all costs, putting screws and rods in the spine at all costs. We're looking at the whole body, and we're treating the patient more than just the spine. We're looking at functional improvement, and we're trying to make the person's spine straighter, but we're trying to make them overall healthier, meaning be able to adapt and to address the scoliosis and manage the curve over their entire life. So conservative non-surgical treatment normally is a very integrative treatment. We're integrating chiropractic care, physical therapy, exercises, bracing, rehabilitation. We're just not just trying to force the spine straight with rods and screws. And we're doing it in a way that patients and children can actually take on this type of condition and really have minimal effect on their health and well-being. Like we mentioned, when we look at scoliosis, you must be proactive at monitoring them, because many kids don't go for pediatric physicals other than once a year. So they can go in at 11 and have no scoliosis presentation, go back a year later, like for a female, and they go through puberty that year, and their entire shape of their curve completely changed. And now they have no diagnosable curve to a very severe curve in that 12-month period of time. So therefore, as parents, you have to look at your children and see what is happening. See if they have any uneven shoulders, uneven shoulder blades, a development of any kind of rib cage arching, and the ribs look different. Do the arms and legs hang at different lengths or different areas between the body? Do their clothes kind of fit weird? Is it, like one pant leg always seems too long compared to the other side? So ill-fitting clothing. These are really important things for you to examine, because this is happening when they're going through puberty, and then most kids during that stage are not in front of you as much. They're wearing bigger clothes, they're kind of hiding themselves, and you don't see them running around anymore, and you could miss this progressive state of scoliosis. And the easiest way of examining this is having your child or the patient kind of bend forward in front of you and seeing their back without any shirt on, and you can actually see their ribs and spine, and look for any asymmetries that are visible and that you can detect them. If you see any asymmetry from one side to the other, there's never a normal reason for that. There's never a normal reason for one shoulder to be different than the other, from one rib cage to be different from the other, from one waist being different from the other. Like I mentioned, there's never guarantees when it comes to treating scoliosis, but it definitely means that if you find it early through your assessments and we intervene earlier during the progressive natures of scoliosis, the likelihood of us being successful at managing the curve and avoiding unnecessary invasive surgery is much higher. So therefore, early diagnosis with early treatment before significant progression occurs definitely makes the outcome or the outlook to be much more positive. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.